Quality improvement involves a combined effort among healthcare staff and stakeholders to diagnose and treat problems in the healthcare system. A stakeholder is anyone who has an interest in a project and can influence its success or failure. In quality improvement, the people who do the work need to be the ones to change the work. This usually requires an interdisciplinary team with representations from, in this case, disciplines like medicine, nursing, and administration. The following stakeholders have been chosen to be the main influencers for this change. For each discipline, clear roles and responsibilities are assigned. The 4 main roles they each play in this project include the requirements for the project, what the project needs from the stakeholders, the attitudes and risks involved with the project, and finally, what actions to take to correct these attitudes or risks. Beginning with the disciplines of medicine, this group involves the collaboration and influence of the pharmacy. The requirement for this project include the monitoring of the Pyxis medication draw times, creating proper labels to accompany any IV push medications for syringes, and the monitoring of medication waste. The project needs the pharmacy to report weekly rates for both medication draw and sign times, as well as the quantity of medication being wasted for every week. The attitudes and risks that can be expected by the pharmaceutical team includes low morale due to the increase in workload and non-compliance. The appropriate action to take to prevent this is to increase motivation by emphasizing the goal of the change. The changes being implemented will reduce medication requests from the nurses and manage stocking discrepancies better by reducing the time frame between draw times and administration times of the medication, rather than having the nurses pull all medications and hold them without immediately administrating. To reduce the workload of the pharmacy should be provided a template to help track the systems under observation, and most importantly, it is essential that the change team be open to communication with the pharmacy and have a member of their team join the briefs with staff. The nursing staff involved is at biggest risk for noncompliance and burnout. It is important to note that this staff is already under immense stress and pressure working in a COVID unit while also supervising nurse interns. However, change can still be effective with the correct amount of support. The requirements needed from the nursing staff includes labeling syringes with IV push medication and immediately administering medication after drawing from the Pyxis. The nursing team should be provided with report sheets to help log times pulled and administered to compare with the systems being observed, as well as logs to track the quantity of medications being wasted. It is expected for the nurses to feel overwhelmed with the additional changes in time management and regulations. To help reduce the impact to the unit staff, administration should provide clear education pamphlets and open comment drop boxes for feedback. A resource nurse should also be assigned to the unit, if available, to support the nurses and interns. Lastly, the last group of stakeholders that have a great impact for change is administration. The project requires that administration initiate policy changes of the administration of IV push medications and help regulate and monitor medication waste. This would require new policy education modules and weekly reports reflecting the change in effect. It is anticipated that administration be motivated by the reduction in waste. However, the new requirement for weekly reports and producing labels and wages for resource nurses could also cause some resistance. To help reduce resistance, the change team should be open to administration's feedback and reflect on the expenses as compared to the savings throughout the change in policy. In conclusion, it is imperative that stakeholders and care teams collaborate and communicate effectively to enhance the transitions involved in the quality improvement process. By reflecting on what their roles are, what is required from them, anticipating their attitudes, and developing plans to support said attitudes, we promote change and increase patient safety.